Welcome back. As we all know, October is recognized worldwide as ADHD Awareness Month, a time dedicated to increasing understanding and acceptance of attention deficient hyperactivity disorder known as ADHD. During this month, educators, parents, and specialists come together to shed light on the challenges and strengthen the individuals with ADHD, aiming to replace the misunderstanding with knowledge and compassion. So, the role of specialists in this field, such as educators, consultants, psychologists, and also therapists, is extremely vital. They work to assess students' needs, guide teachers on effective classroom strategies, and provide individualized support for children with ADHD. Specialists also play a key role in spreading awareness, coinciding workshops, and helping schools build an inclusive learning environment that allows every student to succeed and thrive. Through the awareness and collaboration, we can create classrooms that celebrate differences and empower every learner to reach their potentials. On this occasion, we are pleased to have our guest today, Dr. Caroline Farhat, PhD in Linguistics and Speech Disorders Educational Consultant. Welcome to Good Morning Kuwait.
Welcome. Thank you so much for this invitation. And we can speak today about ADHD, Attention Deficient Disorder Hyperactivity. This is a title, it means in October, so important, and we can do more presentation, and we did it more things for ADHD.
Well, to save time, Dr. Caroline, let's talk about how to deal with children with ADHD. But before we talk about how to deal with them, let's talk about how do you, as a doctor, let's say, diagnose a child with ADHD and then to prescribe how to deal with him?
First of all, they come to my clinic and we can do the assessment. We have two kinds of assessment for ADHD, for adult and for children.
Yes.
ADHD for children, it's due to their ages, and we can observe them. We can do more things, questions, and education, because you know that ADHD, attention deficient disorder, that means they are dependent on their dopamine. Dopamine means that the chemical material in the brain that affects for them, for supporting, for happiness, for emotion. We give this hormone, a happiness hormone. And when we find the character and some symptoms from ADHD, we can continue for this assessment. And then the result give us that they have the kinds of ADHD, which kind of the ADHD they have, this student, 1, 2, or 3, we can speak now about them. Then we can give the result for the parents, and we can speak them. He has ADHD, hyperactivity, attention deficient disorder, hyperactivity, or attention deficient disorder without hyperactivity. Or he has both of them. We can, this is due to the test that we did it. Then we can give the plan, and the plan, we write the diagnosis and we write everything for the parents. How can they communicate with them? How can they deal them? And for the teachers, for the schools, we can write recommendation. How can the teachers and the schools
need to deal with the child? This is what you do in the clinic. But now let's talk about school, inside the school. As a teacher, how do you recognize or spot the symptoms of ADHD?
First of all, the teacher should be patient. If she know or she has to read or to know about what do we mean by ADHD. The main problem if the teacher doesn't know anything about ADHD. If she know that this boy or girl or this students, like a lazy student, without attention. They
Easy
want
to
to come here.
distract.
Yes, and they want to come here to play, to enjoy. They didn't take care for their lessons, but actually they are ADHD, and the teacher doesn't know. We have most of teachers, they didn't know this kind of diagnosis. But if the teacher know the kind of the diagnosis, first of all, she should to be patient. She should to give proof every time, and to put him beside her, and to give him the principal for the school, my assistant. He can help her in the classroom.
Well, back in school, they always say to my mother or my aunt, Mayam is hyperactive. She
Yes.
has a short attention span. That doesn't mean I was ADHD student when I was little, and still I grew up. I have a very short attention span as an adult.
Like I told you before, we have something ADD, attention deficit disorder. This is for the girls, adult girls. It's coming the kind, and we have ADHD, hyperactivity deficient hyperactivity. Attention deficit disorder, hyperactivity, different than attention deficit disorder, because the different age, hyperactivity. But we want to know that the first one, ADD, attention deficit disorder, that depend for short attention, and they lose their self inside the classroom, but they are without hyperactivity, without motivation, without anything. Just they are sitting like this, 5 minutes, first 5 minutes, they attention with the teacher, and then they lose their self, everything. And they told them they has delete memory because they delete everything, they forget everything inside the classroom. No, they didn't forget anything inside the classroom, but actually they lose their self inside the classroom.
Yes.
Attention deficit disorder, hyperactivity, they have behavior, this is noisy behavior for the teachers, for the students.
I was a very noisy
because
and naughty
they can
student.
sit, they can sit more 5 minutes. After 15 minutes, he want to up. After 15 minutes, he want. Maybe after 10 minutes, maybe after 7 minutes. This is that the teacher has a problem inside the classroom. She can't manage the classroom with that student ADHD.
Sometimes they label that student as a trouble student without knowing that he has the symptoms. So what is the first step that a teacher, in that case, if the teacher spotted that, what is the first step?
If the teacher know what do we mean by attention deficit disorder, she has to give him more working. He should be busy.
So keep him busy all the time.
All the time. If he doesn't busy, he can work with her. He can work with his student,
so we are good
friends.
Assistant people.
Yes, but they are kind. They can listen to them. But she should to avoid also her voice.
Yes.
Her tone. They are play with the tone for the teachers. If the tone is high, they are leader. How can I take that? Who are you to speak with me like this?
Exactly.
Who are you to give me like this?
Orders.
No, don't give me orders. But if the teacher is friendly with them, and she told them, I want something from you, please, can you help me? Can you do something?
Yes,
can
so
you do
the
like
tone
this?
here is the key.
Of course. Why the tone is the key? Is the key because they are working for their dopamine. Dopamine means if the dopamine high, they are so good. They are attention. They are writing. They are sitting. But if it's super high, it's difficult for them.
Yes.
The dopamine, if super high, it's difficult for them. Why? Because they can't sit. They can't do. They can't attention. Also, if the dopamine is low, it's so hard for them. For this reason, we can say that dopamine for them should be balanced. How can the teacher balance the dopamine for the ADHD?
With the tone.
With the tone, with supporting words, not comment words, not negative words, positive words, because they like the positive words. They like that you are the king, you are the princess. Oh, thank you. She can support them.
So keep children and students in a positive environment that will balance the hormones, balance the attentions.
It helps them to hide the happiness hormone.
Yeah. So in terms that we talked about the classroom in general. Now let's talk about the school in general. We talked about classroom, the school. Say there are parents who say that if my child is hyperactive or with ADHD, I would get him to be involved in group activities. Does group activities also help to control ADHD or to balance the hormones?
Of course. He has to go to the group activity, and the school should not to ignore these kind of children. Why? They are now some of the schools, not all of them, if they didn't understand the case, they ignore them, they ignore him, or the teachers let him outside for the classroom.
Yes.
Or why? Because always give him punishment, always she shout for him, always she ignore him, but he ask himself, why?
What did I do wrong?
I didn't do anything. Why she do it like this for me? He doesn't know his behavior exactly. The teacher or the school should to give the ADHD student proof. If they give them proof, you did it like this, you have to do like this, the result like this. If they give them proof, they will be gain him. But if they ignore him, it's problem for them.
It's more like dealing with soldiers than children.
Yes.
We like to follow orders, we like to keep to help, assist, and also we need positive energy from you. So it's like dealing with soldiers. Now let's talk about homeworks. I struggled with homework.
Homework, yeah.
And homework for an average student is different, supposedly to be different from ADHD student.
I will tell you one symptoms. It's so important for ADHD. They are boring.
Okay.
They can't complete their activity at the end. This is the symptoms for them. If you can see someone, I can start my work, my activity, I can start my homework, but I can't continue. I want to go to the toilet, I want to drink water.
We always find an excuse.
Always they have excuse to go out and to lose their concentration.
Yes.
But how can we manage this kind of activity? We should to study. We can divide the time by timing, by controlling the schedule. If we put the schedule and the timing, they are controlling themselves. Okay, after 10 minutes, you have a break.
Exactly.
You can tell them. After 7 minutes, you have a break. You can do 2 minutes break and you can return back.
It's like a compulsory schedule.
Yes.
A disobedient schedule to control that or to keep the balance.
Yes.
Yes, and to keep them concentrated to finish the job.
Aslan, they need in their life balance, control, and schedule. If you didn't do from the teachers and the school and the parents, if we didn't do any balance or any control or every time follow up, if they will be married, you have to follow up them because maybe they can finish their graduation in the university and they can go to work with any company, bank or anything or like this. But because they are always excited, they didn't like anything important. They like everything excited.
Extraordinary.
Yes. For this reason, they like the gamers more than the study. They like the gamers. They can sit 5 hours beside the game, but they can't sit 10 minutes beside the game.
Well, okay. My final question before we jump into our next segment. Do ADHD individuals in general, adults or children, thrive under pressure?
Of course. If you pressure them, and they have more problems because they have problems. What's the problem? They are pure. They can't lie. They can save, they can't lie.
Well, that's my problem.
Yes, they can't say lie. They can save. Why I can save like this my information, or I'm scared from you to give me, because you always give me more punishment. For this reason, I didn't want to speak truly with you.
Yes.
But ADHD student, they are truly speaking. Yani how they feel, they speak.
Gonna be speak out with it.
Yani they work about their emotion. Their emotion come from their dopamine. For this reason, they are excited to speak directly.
Yes.
Some people didn't agree about this speaking. Some teacher, they told them, you are lazy. You need to be good behavior.
Yes.
But your behavior not good. Your behavior so bad.
Always the troubled child, always the troubled
Yes.
individual. So,
Yes.
Dr. Caroline, thank you very much for joining us.
Thank you
on Good
too.
Morning Kuwait. We need really to emphasize, especially in the Ministry of Education,
Yes.
we need our teachers to pay attention to ADHD students so they won't get lost.
Yeah,
in
I
the
advise to take care for ADHD. I'm not lazy. I'm not stupid. I am ADHD. Just to understand me,
Yes.
understand and patient for me.
Yeah. Then
Thank
they will thrive. And also thank you very much,
Thank
Dr.
you too. Thank you for this invitation. And I think that everyone should to know who is the ADHD, attention deficit disorder hyperactivity.
It is important.
Thank you so much.
It's our pleasure to have you. So, my dear viewers, all thanks and appreciation to our guest, Dr. Caroline Farhat, PhD in Linguistics and Speech Disorders Educational Consultant. Up next, Kuwait has always been proud of its rich traditions and cultural identity. And there is no better way to celebrate that than through art, crafts, and heritage. So stay tuned for the upcoming report.